Hello,
Hey,
how are you doing?
you are doing well. Good morning.
Good morning. I'm sorry to get in here so late. Had
It
an
is
emergency I was
perfect,
dealing with. Patient
perfectly
emergency.
fine. Your patients come first, right?
Yeah, definitely. Always is.
It is the business that you're in, that we're in, where we have emergency times. But good morning. We're so happy to have you. I
Okay.
talked about the workshop, the expo. And so at least we got that out of the way so we can completely just be engaging with you to talk about this really important topic that basically does not go away, right?
Yep.
Cancer, right? It's been around for a long time. And so I shared with those that were watching that you'll be facilitating a workshop, but that we wanted to talk about cancer because we are approaching October, which is Breast Cancer Awareness Month, right? And so before we get into it, I just want you, Dr. Yagizi, to share with those watching about OncoMed268 and yourself. Yeah.
Thank you so much, Dr. Prince. I am actually very happy to be here, and thank you for inviting us. And one of the things that I am very much passionate about is raising awareness. Okay, so here at OncoMed 268, as the name suggests, we are a medical clinic that caters both for oncological needs, meaning cancer related illnesses, and medical illnesses as well. We are a multidisciplinary team of physicians with specialties such as urology, orthopedics, surgery, gynecology, obstetrics, radiology, oncology, internal medicine. Basically, a one stop shop, so to speak, for anything, even maxillofacial surgeries and certain aesthetic procedures such as surgical procedures or plastic procedures for the face, rhinoplasties, chin improvements, etc., are catered for at this clinic, and we have specialists that will come in as needed. We also have a telemedical service, meaning doctors, if a patient needs a doctor that isn't available on island, we can get a consultation, at least a visual consultation with a specialist from overseas, from the United States. Uh, of course, there is a fee that would have to be paid for their services, but we facilitate that service for you. We also facilitate certain imaging studies that aren't available on island, like PET CT scans, which are needed to diagnose oncological illnesses as well as cardiological and nephrological illnesses, and they're not available here. So we do like a liaison service with the United States. That's thankfully, medical benefit has worked with us to cover the costs of such studies.
I
For
never knew
imaging studies.
that. Oh,
Well, that's why we're here today. That's why we're here today. We also offer
yes.
genetic testing. So we have available here some kits that we work with a lab in the United States and Puerto Rico to do genetic testing to find out what cancers a patient is predisposed to suffer with in the future, so that better kind of orients us as to what kind of screening to pay most attention to, because there are diseases, for example, like melanoma, pancreatic cancer, lung cancer, etc., that don't have a very adequate screening program, screening system for. That if you do have a genetic test that shows that you are at a higher risk than your average to develop this cancer because of this genetic mutation in your DNA, then we're able to do, for example, more specific studies at, at better intervals to kind of look for. So when you're doing screening, Serene, all right, and this is what the topic I'll be speaking about at your event at the in October. What we will be talking about is the screenable cancers, breast cancer, colon cancer, cervical cancer, um, and prostate cancer. And when we talk about screening, what we mean is a group of sorry, when we talk about screening, what we're talking about are tests that a patient can do in order to um, predict or to diagnose a cancer in its earlier stages. So when we talk about screening, what we look for in a screening test is something that is cost effective. One is able to be done quickly and easily at mass, meaning like a mammogram, it's a 5-minute procedure, it doesn't take much. A pap smear for cervical cancer, it's a 5-minute procedure, doesn't take much. It's cheap. It has a high level of, number three, it has a high level of accuracy in diagnosing the said illness, etc. So unfortunately, for a lot of cancers, especially the ones outside of those four that we just mentioned, a lot of them don't have a proper screening method. Okay, so once you do a
name
genetic,
4 cancers again, please?
sure, breast cancer, one, breast cancer, prostate cancer, cervical cancer, okay, and colon cancer. Okay, so those are the 4 screenable cancers we'll be talking about in the presentation in October. But when you have a genetic test that shows you that you are at a predisposition for, let's say, melanoma, okay, then if a patient has a mole that they're worried about, we can pay special attention to that mole and see them on yearly intervals or every 6-month intervals. And if the mole starts to change, we can take biopsies because we know that the patient is predisposed. Under normal circumstances, we wouldn't really pay much attention to a normal nevus or mole on the body, especially even if it's dark in color. We wouldn't track it, so to speak, because it's the patient is only at average risk of developing melanoma. Or if the patient has, let's say, a predisposition to develop lung cancer because of some genetic syndrome, then we can do more frequent X-rays, or every 3 years do a CT scan, or every 2 years do a CT scan, stratify their risk, their smoking history, etc., and better track in order to prevent, or at least not prevent, to better diagnose early any malignancy that they may be suffering. So I think these are services, we haven't publicized them much, unfortunately, up to now, but they're services that the country really does require, and I'm very happy to be able to bring to the table.
No, that's great. We were going to get to this, but I know that you have a special going on.
Yes.
And it starts next week, right?
Yes.
So I'm like, why not just tell us now?
Thank you. Okay, so Serene, we do have a special. Yes, we have a special promotion during the month of October for breast cancer screening. Okay, since October is Pinktober, Breast Cancer Awareness Month, for the whole month of October, we're going to be holding a screening, which spots are filling up fast. So if you're watching and you are interested to get a breast screening, breast exam, ultrasound, you could call at the number that I'm sure Serene will leave somewhere. So what it is, it's a
right now.
all right, great. So what we're doing is we're going to be examining women who acquire an appointment. We're going to do a general physical, just the basic general physical, plus a focused physical exam on the breast and axilla, which normally would cost a little bit more, but we'll be doing it at a much reduced price during the month of October, as to motivate more women to come and get screened. Also, ultrasounds that we would have done before, we're going to be doing them now, if necessary, for the breast and axilla at a reduced rate as well. I'll speak to you later, explain the prices, and maybe you can share with your audience.
Yes, that would be great. I'm trying to find the flyer that you have here. It's not the way I want to share with everyone, but this is the flyer. Yes.
Yes, that is
That
it.
you have.
The info is not showing the bottom.
Yeah. There you go. So there's the number, and so persons can they must call to get an appointment, right, at 268-778-9999. Easy to remember. And this is for all of the month of October. It's just so important to get a breast screening and ultrasound. And they'll be getting it at the medical office of OncoMed268. And so I imagine, Dr. Yagizi, that there'll be some sort of discussion about follow-ups and how continuity of care at OncoMed 268 and the out-of-pocket costs. I think a lot of times, not only a person scared about what's on the other side, but also medical costs. And it sounds as though there are options, right? And thinking outside the box. Yeah.
Correct. So, okay, I don't get into the pricing or monetary part of it much, but our marketing team is actually trying to offer the services, offer the full physical and orientation for around $100 to 125, and a full scan of both breasts and axillary with ultrasound if needed at the price of 200 BC.
Oh,
Normally, that is about double on both cases. So for the month of October, that's what we're planning to do. But for more information, let any patients feel free to call that number on the screen, and we will take our time. If I'm available, I'll speak to them myself and give them all of the orientations that they require. We also have some lovely specialists who have volunteered their time to come and help with the screening if volume it does become um, a factor, so to
yeah.
speak. Uh,
I want to share with those that are listening in Antigua and Barbuda that the cost of a sonogram here, if I was to pull out my billing for you, it is far more expensive than that.
it is. It
I
is.
mean, here in the United States, they break it down and they bill for everything: the assistant, the tech assistant, the,
Definitely.
I mean, you would see this long list
Mhm.
of getting a breast exam or sound, I should say, screening and ultrasound, and it is very, it's the cost is probably 3 times the amount that you just mentioned to me, if not more. So I just thought I should share that when people are thinking about it being expensive. I just want to give them some insight to what it costs here in New York City, where I'm at right now. And it is very much more expensive than that. But typically, you cannot put a price on your health because what you'll pay for not in being preventative and engaging with yourself in a way that is caring can cost you a lot more, and as well as the people that you love. Yeah.
Definitely. That's actually exactly what we were thinking when the team and I met to try and organize this screening. One of the things that I put on the table that I just wanted very, very clear. I want to waive all costs possible except for overhead fees, which, those are things that will have, because since it's a private office, those are things that we would have to cover or account for. But everything else, service charges, medical fees, assistant fees, etc., those should be waived, which is why we're working with that number right now. It hasn't been 100% consolidated, but we have an idea the range that we want to leave the services at.
Yeah. And even if it's not long term, it's a start for persons to begin to engage in a more preventative way.
Definitely.
You know, I was discussing with them that I'm a holistic psychotherapist, and I have clients who have discovered that they have a non-malignant lump or a malignant lump. Some clients come to me because they are at the age where their mom, their grandmother, their paternal grandmother had breast cancer. And
Mhm.
unbeknownst to them, that there was this fear stirring up in them. And so we would talk about that, and I would discuss with them, what approaches are you taking? And while you're in psychotherapy, this would be a perfect opportunity to see your physician, right? Because then whatever's on the other side, you can process with me every week. And so I've had clients who had discovered and had a mastectomy, and because they waited long, but post-op, they were able to engage with me. We were able to talk about lifestyles. We were even able to talk about triggers that it seemed as though certain long periods of lifestyles, and that could be being in a stressful relationship, being in an emotionally abusive marriage, eating, or triggers that lead to just unhealthy lifestyles. I don't necessarily, and I'm not, I'm not a doctor, but not necessarily that it caused cancer, but if you're already predisposed, I imagine that it can just sort of magnitude and accelerate that in some degree.
Oh,
Tell me
definitely.
right or wrong or whatever. I don't know.
Definitely. You actually hit the nail right on the head. One of the major factors for any cancer patient in doing well, especially in doing well during treatment, is a positive psyche, a positive frame of mind. Now, you spoke about things that stress patients, predisposing them to cancers, and that's in no way a lie, because one of the things that, apologies, I'm on call, so this phone doesn't stop going off. I apologize. So one of the things that we see happening when somebody leads a very stressful or stress charged life is higher levels of stress hormone, cortisol, which has a negative impact both on fat production, the immune system, which it suppresses the immune system, and predisposes you as such for both infections, viral infections, bacterial infections, um, reactivation of things like shingles. If you had chickenpox once upon a time, if the virus never dies, it stays in your nerves, and when your immune system dips, shingles start to happen. And of course, because cancer is a genetic and immunological disease, it predisposes the formation of cancer. It predisposes you to the formation of tumors that could become cancerous or cancer in itself. So yeah, obviously and most definitely, the psychological sphere is very, very important.
And I'm so happy. I know we're not on the whole script, but I'm flexible because I'm so happy to hear that there's genetic testings, because I sometimes refer clients for genetic testings when it comes to psychotropic medication. And in particularly Black and brown people, because what a lot of research, at least here, a lot of research are not involving Black and brown people because, one, typically they're not approached to engage in research, and two, the stigma surrounding not only mental health but even cancer itself, we would more than likely say no, we don't want to engage in it. So the research surrounding a lot of treatment are not involving our genetic makeup. So for some clients who are taking psychotropic medication, they'll say it's not working for me. And so, I would say, well, what are the conversations that you're having with your psychiatrist? And similarly to you, I said, well, would you consider genetic testing to see what genetically may actually work for you? And I had two clients that did it, and it was life changing. So I'm happy to hear about this. So I don't know if you can just share just a little bit more about genetic testing, because I think that is phenomenal in Antigua and Barbuda.
Definitely. So for now, what we're doing is offering a service where patients can give a biological sample, which consists of basically some saliva, in a tube, which is sent through the U.S. and is scanned for 29 different familial cancer syndromes. Okay, so this is most useful for patients who do have a cancer with family history of cancer, or for patients who don't have a cancer and have a very florid family history of cancer, to get checked and see what is their predisposition or their risk of developing certain cancers during their lifetime. So I'll give you a very workable example. A patient comes in, she's 38 years old. Um, Her general aspect looks, she looks absolutely terrified when she sees you. She's sweating, her blood pressure is high. And when you sit down and speak with the patient, she's obviously anxious to be there, but she's there anyway. So when you ask the patient what's wrong, she comes in saying, well, doc, really nothing is wrong with me, but I lost my young 42-year-old sister to cancer last year. Our mom died from cancer when she was 45, and we were only like 10 years old and 15 each. And I am just so horrified of the possibility that I might get breast cancer myself, because our maternal aunt, a great aunt or a grandmother aunt, I'm giving you an actual case that came in. So my maternal aunt also died from breast cancer at the age of 60, which is in retrospect not a very old age, it's a younger age. So I'm here and I don't know what to do. I'm here for my breast exam, and so I offered the genetic testing as an option, as long with a screening, which she would require. Even at 38, she would require screening because of the high risk. And she was happy to hear that screening, genetic testing was available. Unfortunately, this is not covered as yet by medical benefit, and it is quite costly. But she luckily had insurance and was able to get the testing done. So it just turned out in her situation, she had no direct syndromes that predispose her to cancer, but at least now she knows that this incidence in her family was sporadic, was spontaneous. It wasn't something that she was genetically wired to develop. So that brought her a lot of ease of mind. And even so, because of the trend that we saw in her family, we still screen her every year with ultrasound until the age of 40, after which she'll start doing breast mammograms once a year, and we do physical exam yearly.
Yeah, I mean, that's great. What can you talk a little TMI? So I don't probably should share this with people, but I think it's important to mention I have what they call cystic breast.
Okay.
So,
Disease.
yeah. So what can you share with persons surrounding having cystic breast? They're probably checking their breast and they're feeling like these different masses and things like that. Yeah.
So fibrocystic breast disease is only diagnosed via biopsy. Okay. So a lot of women do go to their doctor and they get a breast exam, and the doctor tells them, well, your breasts do feel a bit nodular or lumpy. It could be because of your young age that your fibroglandular tissue is still very vibrant and thick and dense and well irrigated, etc. Therefore, it could just be that, or you could have maybe a bunch of cysts or small nodules, benign nodules called fibroadenoma. They might do an ultrasound if they're young, below the age of 40. They do an ultrasound, which would reveal a bunch of cysts and little round, benign-looking lumps. And a lot of times doctors would tell them, hey, you have fibrocystic breast disease, nothing to worry about. However, in practice and in medicine, the ultimate word goes always to pathology, at least in oncological illnesses. So if, for example, a patient comes to my office, we do an ultrasound, we do a physical exam, and there's about 5-6 lumps in the breast. We do an ultrasound just to see which lumps look the most suspicious, which lumps look bad. And we see that there's 2 hard, solid lesions, well circumscribed. The borders are well defined, and there's about maybe 5 more cysts, which are bags of fluid on the breast. We're already thinking of fibrocystic disease, but in order for us to definitely diagnose this, we must remove the solid masses and have them tested to make sure that they're actually fibroadenoma and they're not malignancy. Okay. So once the result comes back showing fibroadenoma and we know that there's cysts there, or fibrocystic disease comes back on pathology, then we know it's fibrocystic breast disease, and there's nothing to worry about in terms of the masses that are currently there. However, fibrocystic breast disease does carries a small risk of patients developing breast cancer sometime in the future. And when you look at the statistics, which show that 1 out of 8 women will be diagnosed with breast cancer before the age of 70, it's a bit of a terrifying reality to face. That's 12% of women. So I want to touch up on something that you did mention that I think is absolutely important, and something that all people
to know. I have a clear bill of health. I get my I had everything done that Dr. Yagizi just mentioned. And people are probably like, oh my God, like, no. And I get to two, thorough exams. But go ahead. Yes.
That I'm happy about. That I'm happy about. Definitely, I'm happy about that, and I'm happy that you're proactive with your health. But one thing I wanted to touch upon that I think is very important, and people don't really realize it. I'm happy that you actually brought it up, because when I say it sometimes when I'm on an interview and I do say something like that, people open their eyes, like, he's talking about race and it's a sensitive issue. But really, truly, not only is it a sensitive issue, but it's a pertinent and very, very important issue to talk about. Most of the studies that we study in our textbooks are based on studies and investigations done in developed countries like the US, Canada, Europe, who obviously their demographic does not account much for minorities, neither Black and brown women, as you say, Middle Eastern women, Latin women, etc. So these statistics are held as the gold standard or the golden stats for certain diseases. And I'll give you a very simple example since we're on the topic of breast cancer. Now, if you go on Google and you see incidence and survivorship of breast cancer, you'll see stats. U.S. statistics show that stage 1 and 2 breast cancer is diagnosed 90% of the time because of screening, and survival at 5 years is 98% in stage 1 and 2, 95% in stage 3, whatever. Right, at 5 years, and that the average age of diagnosis is 59 to 60. But then again, when you really check the numbers, all right, 70% of the cohorts are comprised of Caucasian women. All right. Now, when we check our local statistics, which we've successfully compiled this year, actually, I'm going to be presenting the statistics at this year's breast cancer symposium. For our populace between the year of 2019 and 2022 September. So if we look at those statistics and the statistics in the previous 3-year assessment for the patients at Solas Bird Medical Center, our average age of diagnosis is not 60, it's 55, right? Mm-hmm. So Black women are definitely diagnosed at an earlier age. And this is, if you do some more digging, even in US stats, you do more digging and you talk about African American women and their predisposition to develop breast cancer, it's the same. They're on average diagnosed at the age of 54 to 55, whereas Caucasian women are Caucasian and Latin women are diagnosed at an age of between 59 and 62. So that's a 5 to 7 year gap, right? That's a lot of years. So another thing that you look at is survival. Now, patients that are diagnosed are of Afro-Caribbean or African-American or Latino African descent, they have a higher probability of dying earlier from breast cancer than Caucasian women or Latin women of other descendants. Okay, the highest risk population for breast cancer in terms of age of diagnosis, etc., is actually African American and Middle Eastern women. All right, so unfortunately, for you and I, and the women in my family, we have a higher probability of being diagnosed with breast cancer at an earlier age, and that the cancer be more aggressive in its natural development.
I don't know about the early age, but in terms of the survival, could that be linked to access and also being more than likely predisposed to higher levels of stress as a Black, I'm going to say as a Black woman than my white counterpart? Could the levels of stress that I'm likely to endure just by whether it is work, whether it is the societal
limitations, right?
Things that are set that I'm more predisposed, which is true. I am predisposed, and I'll just speak for myself, to higher levels of stress, let's say in a work environment, than my white counterparts, which can lend to, if I am predisposed to cancer, which I'm not, as far as I know, But if I was just happenstance and I endure higher levels of stress, then that will make my survival rate high. I'm less likely to survive cancer. Am I making sense?
I guess I understand exactly what you're saying. Okay,
Yeah.
what you're basically saying is because of your racial background and because of the society that we are in, maybe you're exposed to more stressful day-to-day events than other races.
Right.
Now, that is something that, of course, when we do analytical studies, we have to consider all factors. Okay, but when you look at the incidence um, in the United States for African American women, for example. And then you look at I would understand if it was only with African American women in the United States and African American women or African Canadian women. Okay, then I understand. They fall into a minority. There are societal obstacles which predispose them to more stress, etc. However, when we look at Afro Caribbean women, women who live in a majority or a country where the majority are of African descent. And we see that the numbers are very similar, okay? Maybe not exactly the same, but different by 1 or 2%, or even decimals, okay? In terms of age of diagnosis, percentage of women that make it to 5 years after diagnosis per stage. We find that they're very, very similar. So maybe it's more of a genetic explanation in this case than a societal or a social risk factor now or environmental risk factor. Now the the conundrum falls where when we compare Afro-Caribbean women to African women, okay, in Africa the incidence and the numbers are very similar to those in Caucasian women, especially in developed African countries. Okay, of course, in places like Liberia, Cote d'Ivoire, and other countries in Africa which fall below the poverty line and have very poorly developed social health systems, etc., the numbers are going to be much worse. But when we look at similar conditions, countries with similar conditions to the Caribbean and to North America, etc., we find that the numbers are more in tandem with Caucasian numbers than if we look at and compare Afro-Caribbean women or African Latino women to Afro-Latino women to Caucasians in the United States.
That's interesting.
It's very
Yeah.
interesting.
Because I think about the stress, and then I also think about access, right? In Antigua and Barbuda in particular, how much access is there to adequate um, cancer prevention or cancer screening, I should say, and also as well as and I know we're ending soon, also the lifestyle in which persons are actively screening themselves for breast cancer on an annual basis, depending on their age, their predisposition. Even here, people are like, oh, you're in the United States. But a lot of times people are not actively seeking or screening
Yeah.
themselves. And that's usually the issue because they're so oftentimes busy about other stressful things, getting to work, their children, and bills, that they're not integrating cancer screening into their medical care. So I just wonder, what would the numbers look like if Black women of those of African descent were actively screening themselves on an annual basis, even biannually? What could that look like for us? And that's where OncoMed comes in, right?
Well, yeah, that point is stellar, Serene. Um, that point is stellar simply because I'm not going to say that the age of diagnosis is going to change because that is a genetic component, but at least the stage of diagnosis, which is 75, 80, 90% of the battle won, right? Let's put it into numbers so that, as you said, let's put it into numbers so we can better comprehend. For patients diagnosed at stage 1 and 2, on average, the 5-year survival is 98%. Okay, so if a woman, whether she is Caucasian, Latin, African American, Afro Caribbean, etc., is diagnosed at stage 1 and stage 2 on average, not taking into consideration and classifying them in how aggressive their type of cancer is, but in general, like a general number, 98 to 99% of women reach 5 years on follow-up, no problem, after they receive all their treatment. Okay, now let's drop from stage 1 and 2. Let's go down to stage 3, which is a more advanced stage. Okay, women who are diagnosed at stage 3 have an overall 5-year survival of about 89% to 92%. So that's a huge dip. Like from 99 at stage 1 and 2, we're down 10 points. Okay, 10 points in stage 3. And for stage 4 cancer patients, if we don't take into account how aggressive their cancer is, their type of breast cancer is, 5-year survival at stage 4 is around 15%. Okay, which is a huge, even a bigger dip than stage 3. At 10 years, stage 1 and 2 have an overall survival of around 92 to 94%. Okay, 10 years. And that's largely in part due to the fact that a lot of these women who are diagnosed with breast cancer are already 65, 70 years old. And when they are diagnosed, in 10 years, they pass away from other reasons other than breast cancer. But when we look at stage 3 now, when we look at stage 3 breast cancer at 10-year survival, that number goes down from 89 to 92. It goes up from there down to 79%, 70, 76%, around there. Okay? So that's a huge dip. And unfortunately for stage 4 cancer patients, barely any make it to 10 years. All right? So the number is not significant, maybe 1 to 5%. Those are very, very lucky ladies. All right? So, I mean, if screening is done properly, you are almost guaranteed to get the cancer early, unless it's already been there for a long time and you started screening late. But if you start screening from the age of 40 with yearly physical breast exam with your doctor, mammogram, and monthly, at least monthly self breast exams, I mean, you're examining yourself, we're talking about a diagnosis rate. If we reach an incidence, a diagnosis of 90% being diagnosed in stage 1 and 2, I think we can almost get rid of breast cancer in Antigua. And it's a small island. We can most definitely do it. It's a small island. We're not talking about.
That's what I tell people all the time in terms of any prevalent diagnosis. I said, you have an advantage because you are a small island. So as wide as things spread, it's as wide as it can be eradicated. And
Definitely.
that is your superpower, and utilize it, right? And so I'm hoping that those that catch this, they start sharing it. Call OncoMed268 so that we can get rid of cancer, or at least the death, caused by cancer. Call OncoMed268 at area code 268-778-9999. I like to say the area code because we do have expats in Antigua and Barbuda. We do have persons who are visiting. We have persons who have different area codes. So 268-778-9999. The month of October, they have a special promotion of breast screening and ultrasound, and it's by appointment only. And so call, please. And you can also join us at the Free Health and Wellness Expo. That is the 11th of November, and Dr. Yagizi, OncoMed268, will be there sharing their information. You will get brochures. You will find out how you can schedule an appointment. You will find out their specialties, the type of treatments that they offer at their offices. Not only is it cancer related, but a slew of other things. I may need to schedule my own appointment. So while I'm down there, because I'm in Antigua quite often, and you're not going to hear this, but I've actually delayed my sonogram because I was in Antigua and Barbuda and I got thrown off because I have it on my calendar. So now I know where to go and probably get it a lot cheaper. And get great, right, quality care. So yeah.
Definitely.
So thank you, Dr. Yagizi. I know you had a medical emergency, and I really, really appreciate you. We appreciate you for rushing in and joining us to share this important information. And again, everyone, please call OncoMed268 to schedule your breast screening ultrasounds at 268. What is the number again? 778 9999. And see you all the 11th of November for the free expo, and it's the free workshop with Dr. Yagizi. Thank you so much. Much appreciate you, and have a fantastic day.
You too, my dear, and thanks you again for inviting me. It's always a pleasure, and I'll see you. I'll see you in October or November, depending on when you come to Antigua.
Yes, I'll be down there in a few weeks, so you'll see me.
You take
All
care.
right. Have a good one. Take care. Bye-bye.